Hello to everybody joining us. I see uh, people starting to enter. Welcome. See more people joining. Good morning, everyone, or afternoon or evening, depending on where you are in the world. Just give it another minute here as we wait for everyone to join our webinar. Okay, so it is 8:04. I think we'll begin, and people can join throughout, and they can join in. I see a few more people. Give them another minute. Okay, I think 8:05, so we're good to go. So I'd like to welcome everyone to MADRE's virtual training on domestic violence in the midst of the pandemic. Thank you so much for joining us. We're really happy to have you here from across the world. I see attendees from pretty much every continent and region. So it's really, really great to have all of you here. First, what I'd like to do is review some technical items. So I will share my screen with all of you to share. One moment. Great. So here we are, a training on domestic violence in the midst of the pandemic. Today's training will be conducted in English, but we also have translation available in Arabic and Kurdish. If you click the interpretation feature on your Zoom screen, you'll see this at the bottom. You can then select your language options. Unfortunately, I'm here in the US and our Zoom software does not allow us to select Arabic or Kurdish. So what we'll have today is Arabic translation will be on the German channel and Kurdish translation will be on the Portuguese channel. A bit confusing, but you can go to German channel for Arabic and Portuguese channel for Kurdish for your translation needs throughout this webinar. And then we'll be speaking in English here on the English channel. I will also, in just a second, I will include closed caption options for those who speak Arabic. If you would like, you can click on the link that I will add to the chat, and that will direct you to a service that will allow you to see this webinar in closed captions in Arabic. You can also see already that we have closed captions available in English at the bottom of your screen as well. And you can chat us at any time if those are not working or if anything comes up with the translation on your end, if you're having difficulty hearing. Next, at any point in time throughout the training that you have a question or a thought, please share it with us. We would love to hear it. There is a Q&A button on the bottom of your screen, and you can submit your question there. We may not have time to get to all of the questions today, but we do encourage you to share as many as you'd like. And then depending on our timing, we will hopefully answer as many as possible. There will be sections in the webinar dedicated to question and answer. So we hope to get to as many of your questions as possible. And then finally, before we begin, I just want to introduce Lisa Davis. Lisa is here with me today to join our conversation. Lisa is the Senior Legal Advisor at MADRE, as well as the co-director of the Human Rights and Gender Justice Clinic at the CUNY School of Law, an expert in this field. And I'm really, really happy to have Lisa here joining me today for this conversation and webinar.
Well, thanks, Danny. It's great to be here and really looking forward to engaging on these issues.
Great, thank you. So let's dive in. So we're here today to talk about domestic violence and how to prevent, address, and document domestic violence in the midst of this pandemic. We'll talk about what domestic violence is and what that looks like in different places of the world. But to start, I want to give you a little bit of background on MADRE's work in this space. So we know that domestic violence and other forms of gender-based violence increase during crisis and conflict. We have seen this throughout history. And when the COVID-19 pandemic spread across the world, it was clear that this moment would be no exception, that domestic violence would also rise, especially given that so many of us across the world were quarantining in our homes. It was a more confined situation than previously. Domestic violence was already a global issue before the pandemic, and it was already on the rise. So in this moment, it quickly became a pandemic within a pandemic, essentially. At MADRE, we work alongside partner organizations across the world, and these partners are really at the core of everything we do. And many of them work on domestic violence, as well as community responses to crises, like a pandemic. And we wanted to support them in their work and help them respond to this important moment in any way that we could. So what we did at MADRE was conduct 2 assessments of the type of responses to the increase in domestic violence. And there were some interesting findings that I want to share with you. First, in the first assessment we did, it was a local assessment based on grassroots organizations across the world. We saw that some grassroots organizations were quickly mobilizing and had developed really creative and really effective solutions to working within the pandemic environment while still supporting those at risk of domestic violence. And we'll talk about some of their solutions today. We also saw some organizations who were unsure of how to proceed in this pandemic, and they were essentially shutting down their programs because they had no alternative. They had no way of proceeding in a way that was safe for their staff and for those they were supporting in their communities. The second assessment we did was an international level assessment. Domestic violence quickly became a priority for the international community after the UN Secretary General issued a call for a ceasefire on domestic violence, which was a really important moment in making sure that this was an important conversation around the world. But there were very few solutions for how to address domestic violence in this new environment, and the solutions were not in sync with what grassroots groups needed or what they were looking for. So it wasn't very effective for them. There was a lot of different ideas of what domestic violence meant, a lot of different definitions, a lot of different understandings, most of which focused only on intimate partner violence and did not encompass the other forms of domestic violence, which we'll also talk about today. So that leads us to our domestic violence toolkit. So if I can, oh, great. So using this research, MADRE and a coalition of diverse organizations created a toolkit that compiles the best practices of grassroots groups from across the world, showing how they were adapting to the pandemic to not only address the increase in domestic violence, but also to work safely and prevent the spread of the virus. So these 2 things in tandem. The toolkit has been shared far and wide in 6 different languages. You can see the covers of the toolkit here in English, Arabic, and Kurdish. And it is full of examples and different tools and practical tips that you can use to adapt to your local community. The toolkit is really the basis of our conversation today. For those of you who have not seen it yet or have not been sent the toolkit, we will follow up with you after this webinar to make sure that you have a copy of it so that you can read through it, share it with whoever you'd like, use it however works for you. So I think before we really talk about how to prevent, address, or document domestic violence, we need to talk about what it is. What is domestic violence? If we think of it as one form of gender-based violence, that's a good start. And we'll talk a little bit later about the difference between those two. But first, we have to start with domestic violence is just one form of gender-based violence. We also know that domestic violence is often conflated with intimate partner violence, but a broader lens and understanding of DV shows us that domestic violence is broader than that, and there's more to it than just intimate partner violence. One way to think of domestic violence is household and/or family violence. So essentially violence that happens between members of a household. So that can be partners or spouses, but it can also be parents and children, other relatives or family friends, extended family, anyone living in the same household. And that could include roommates or even landlords if they share a space with you. If we think of domestic violence as household or family violence, we see that DV can be physical, it can be sexual, psychological, emotional, or economic. And we'll have a discussion later on what that can look like. If we look at this definition of domestic violence differently, beyond only intimate partner violence, to think of this broader lens of household or domestic violence, we can start to see and start to include the intersections with racial minorities, LGBTIQ persons, persons with disabilities, and other marginalized groups who face domestic violence in their daily lives and households too. So for example, domestic violence can include so-called honor crimes. It can include acid attacks, forced genital mutilation or cutting. With this broader lens, we can include forced early and temporary marriage if it's within a household, restricting survivors' access to financial resources or money, withholding medications and assistive devices for persons with disabilities. And of course, this can also include sexual violence, including marital rape. By understanding domestic violence in this more inclusive way, we can start to see that domestic violence can look like so-called honor killings in Iraq. It can be femicides and killing of women by people they know in Guatemala. It can be corrective rape in South Africa. It can be abuse of domestic workers in the United States, and more. There are more examples. Never before have we really seen these things as having anything in common. They're often discussed in their own little silos, across regions or separate, but we've never really thought of them as having anything in common. But now they can all fit under this broader understanding of domestic violence. These crimes are so often otherized or considered too private to talk about. But with this understanding, we can really start to find solutions for violence that is often invisible or hidden in the shadows and make them visible, bring them out of the shadows so they're no longer considered private. And then we can really have important conversations about how to end these forms of violence. It's really about, in this way, it's really about ending the stigma and culture of silence around this issue so that communities can prevent and address all forms of violence and really support survivors of the violence. One thing to note is for some of these crimes, governments try to say that they are private, as we've said, or often that they're part of culture. They're part of a way of life. But with this understanding, we can see that there's actually a universal standard that all of these crimes are in fact domestic violence. Instead of framing this as culture, we can start to frame it as violence, because violence is never okay, especially when it is violence that is justified as a way to enforce community rules or discipline someone, often in the name of culture or tradition. By seeing domestic violence in this way as well, we can really start to show a pattern of crimes. And we can start to make it easier for grassroots organizations, for international organizations, anyone. We can make it easier for us all to demand rights, resources, and remedies for survivors at all of these different spaces, and have these important conversations in ways that we really couldn't before. So that's just an overview of domestic violence. And we could talk about this all day, and it would be really great if we could. But next, I want to move to a little bit of an exercise so that we can dive a little deeper into different forms of domestic violence and how we can tell the difference between domestic violence and gender-based violence, kind of using this broader understanding. So what we're going to do, and I'll type in a minute, what we're going to do is in these two categories, I'll share some examples, and then we'll ask you for your own examples or questions, and we can really figure out if that example is domestic violence or a broader form of gender-based violence. And I'll type these here so that we can all see them together. Sadly, I'm only able to type in English, but we will say them out loud so that anyone using translation can also hear what we are speaking about. So let me just go here and just give you a few examples to show you how this will work. So one example that we've heard of, actually from one of our partners, that we think is a really interesting example of domestic violence that really helps to show how it is broader than intimate partner violence or more household based, is one of the partners told us a story of how a woman in her community who had a miscarriage was essentially punished because it was considered to be her fault. And she was isolated within her community and was definitely shamed because of her miscarriage, which was something, out of her control. It was something related to gender. So for us, if we look at this with this broader understanding, we can start to see that this is in fact a form of domestic violence. You can say it is physical if she's being denied the healthcare that she needs. It can be psychological because maybe she's feeling shame from her family or community or anyone within her household. It could also be economic if she's no longer able to work, or if her family is refusing to give her money for the market or whatever it may be. So I will just type here, miscarriage. Is one example. One example of gender-based violence on a broader scale that I think really helps to set the difference between the two is something like trafficking. Certainly, sometimes this can be within a household if a parent or a sibling forces someone into a trafficking situation or enslavement. But trafficking is very often across border. It can often be organizations who are trafficking others. So we can put that as an example of gender-based violence because it's not necessarily household. It's not necessarily a family act. It is, as I said, a cross-border type of crime. So let's type here, trafficking, essentially cross borders and organized. So those are the kinds of things we think of between the two. One more example that I will kind of kick things off with here before I turn to the chat is an example that we also received from one of our partners that we talked to very early on in the pandemic. who asked us if someone who is menstruating, who is having their period, in this community, people who are menstruating are isolated for a week. They are put in essentially a small house or a small area, secluded from the community. They're brought, pretty mediocre food or less food than they would have on a normal week. And they're isolated from the community until they are finished their menstruation. And there's a lot of shame there. There's a lot of potentially psychological harm there of isolating someone. Again, economic, because they are no longer able to work that week, no longer able to spend money that week. So this is another kind of nuanced example of domestic violence in the form of household or family. This is something that is considered framed as cultural, but we could really start to frame it as violence. And we could start to say that, someone who menstruates it is a natural process. It is nothing to be ashamed of. It is nothing that warrants this sort of physical or psychological violence. And that the violence that is carried out is really used to exert control over this person. So let's just type that as well. Menstruation. Isolated from community. I think that will help us there. So what I will do is just make these look consistent for everybody. Great. So now I'm just going to pop over to the chat and see if we have any questions. Let me see if we have anything. There's a lot of different screens coming, so okay. Great, I'm seeing a few different things here. Thank you as well to my colleague Ahmed, who many of you are seeing in the chat. Ahmed is with MADRE, he's on our advocacy team and is here to help with some of the chat and questions. So thank you so much, Ahmed, for fielding all of these things. I'm just seeing if there are any questions. I'm seeing some great comments that domestic violence is one of the biggest phenomenons in society. That this example, I don't know which example, but it does happen in Nepal, which is really, really interesting. We hear often the two examples that I've given sometimes happen in indigenous communities and more rural communities, and really thinking more a little bit about the scope of that violence and how that impacts those communities is really something our partners brought to our attention. I think it's really, really powerful. Let me just see if there's any other, does anyone have any other questions? You can feel free to send them to the Q&A. Let me just scan again. Oh, here's Lisa. If Lisa has anything to add as well. Here's a good one. This is a great one. How about if women have no rights to decide when it's time to sell families' land? Will it be domestic or gender-based violence?
Right, and what makes that violence? It's a great question, Danny.
Yeah, it's a really great question.
The question is, if you're in a society where men have the right to sell their property, but women don't, so they don't have the right to be on the title for property. So this would be different than if we were under a law that said both men and women couldn't have access to the right. But in a situation where women have access or don't have access and men do, like the example you brought up, Danny, with women who might not have the right to inheritance or the right to sell their land or their house, or the right to other family kinds of rights. Is that violence? What makes that violence? And what makes that gendered?
Yeah, I think that first thing that comes to mind is that this is a really good example of economic violence. That this is certainly attached to livelihoods, it is attached to family funds, And it certainly is gendered. Like you said, if there isn't really a law that stipulates this, or potentially the a person's marriage was not technically legal, and there's no real right for a woman to be part of that conversation when they are selling the land. I think that this could certainly be a form of economic violence within domestic violence. It can be, it compared to more of the broader gender-based violence, this is household, this is family. And it might not be, how we understand violence traditionally. This isn't really any potentially anything physical happening here, but it could also be psychological. It could be, forcing a woman out of family decisions could feel isolating. It can feel really harmful, and it really impacts communities as well.
That's a great point, that economic violence can also trigger other forms of violence, like psychological abuse, right? Like not feeling like you're empowered or in control of your own life, your own destiny. And it's interesting when we look at the issue of a woman being able to sell property, because if a woman is not allowed to sell property, but a man is, then that's gendered. That's gender-based violence. And, right there, right? And what makes it gender-based violence is that you have discrimination, and you've identified the discrimination because it's a right that men have that women don't. What makes it domestic violence would be, who is it that we're targeting? Who's the perpetrator? So for example, let's say that under law, women have an equal right to sell property to men, right? The law says men and women both can own and sell property, but your husband says you can't. Your husband says, I'm not putting your name on the title or the deed to the property. I'm not letting you have control over whether you can sell the house. That makes it domestic violence, right? Because let's go back to our test. The test is whether it's family or household violence. And so in that case, it's a family member and it's in a household, right? It's a husband, and presumably they live together. So, or even if they were separated or divorced and he wouldn't let her, that would still be domestic violence. Now, if you're attacking a law, if you're saying the law is not allowing women to provide property, and your husband says, I want you to be on the deed, but they won't let me add you to the deed because the law says women can't be on that deed, then it's gender-based violence because you're going after a law. But if it's your husband who doesn't want you to do it, or if it's both, if your husband says, the law says you can't own property, and that's right, only I can own it, then it's both. So it's always about looking at who is the perpetrator, who is being held accountable. Is it the government? Is the government being held accountable? Because the government makes laws. So if it's a law you want to change, then it's gender-based violence. And if you're going after a husband who is denying you the right under law, or maybe even just agrees and enforces a law that's discriminatory against women, then it's domestic violence. So in the case of property, that's such a great question. I'm glad it was asked in the chat, because it could be both. And you could make the argument that it's both depending on the facts and the context.
I think this is a really great link. This law versus kind of family and household is a really great link to another question we have in the Q&A about discrimination against LGBTIQ people. And we've seen this come up many times in this conversation. And this can relate as well to this law or family. So if there's a discriminatory law that in some way persecutes or limits the rights of LGBTIQ people, that is gender-based violence. That is a government thing. That's not necessarily a family or household type of violence. But one thing we've seen in this context in the pandemic is that LGBTIQ people have often been sheltering at home with their families who may not accept them for who they are. And that can easily become a violent situation, whether it's physical violence, psychological, economic violence, if they're refusing to support them with funds or even food or general services. You look at that test, you think of it again as, is it a law? Is it a government issue? And is it gender-based violence? Or is the family involved? Is the household involved? We've seen examples of LGBTIQ people or queer people who are in very, risky situations in their homes because their families do not accept them, but they have nowhere else to go. They have nowhere else to quarantine, and leaving their homes would make them unsafe as well. So they're kind of forced into this family violence situation that we absolutely can consider domestic violence. So let me just write that here.
Yeah, I saw another message in the chat box talking about someone sharing their personal experience of being subjected to verbal abuse and physical abuse from relatives, but felt like they had to endure it because they had children and they have a family. And that's, it's so common that happens, right? Because domestic violence is also about control. And when we have no economic opportunities, when we have children and we might not have legal rights, or we might not have an opportunity to be able to take them with us if we need to flee or if we want intervention. Sometimes we see that. We see perpetrators use that against their victims. They threaten, they'll even threaten, I'll take the kids away from you if you make any complaints. Which is why it's so important for countries to have laws that specifically address domestic violence. And one of the things we've seen in advocacy is that when a country is challenged about why it doesn't have a domestic violence law, the country will say, well, assault is already illegal. You can't hit someone, it's already illegal. Why do we need a domestic violence law? And they intentionally want to miss the discrimination that's involved in domestic violence. So the difference between an assault law and domestic violence is the recognition of gender discrimination. It's recognizing that discrimination against women. So if we were advocates and we were challenging the government for a policy that, say, going back to the example, said that women weren't allowed to own property, only men are, we could actually make the argument that that discriminatory provision under law leads to domestic violence. It reinforces domestic violence, because we know that when you don't allow women to be able to own or sell property, that leads to economic violence in the household by partners or other relatives. So we can always see the link between gender-based violence and domestic violence, and we can use it in our advocacy when we're advocating for changes. Sometimes it's hard to advocate to change a law on whether women can own property, because if we just base it on discrimination, lawmakers who don't care about discrimination aren't going to do much to change it. But if we can link it to violence, if we can say, by changing this law, you'll help to reduce domestic violence, that creates a type of advocacy pressure that gives us a tool to try and push for that change. And that just doesn't apply to property laws. It applies to other laws as well. But it's something for us to always think about in our advocacy toolbox, so that we're not just looking at domestic violence segregated out, and we're really looking at how it interacts with other forms of discrimination.
This also links really well to a question we have in the Q&A about different audiences in Myanmar, and how, just to summarize the question, basically saying that domestic violence is only talks about as between two married people. and how we can make this conversation broader and less limited. As an advocate in Myanmar, how can you do that to lead the conversation beyond the presumption that it is just between married people, which I think raises interesting points. Basically, what Lisa was saying is we're looking at it broader. We're linking all of these things together to show the different types of violence. But of course, in many communities, we can't forget, I don't want us to forget in this conversation that the intimate partner violence and violence between spouses is a very important form of domestic violence that we do still need to include in the conversation and address. It really comes down to thinking about these broader examples to help link these types of crimes that are often in the shadows to make a stronger argument for changing them, to try to get these domestic violence laws in countries. One example I can think of that shows how to think a little bit bigger about this is that many countries and many laws will say that, of course, violence between spouses is illegal, it is bad, it is violence. But what they might not include is something like marital rape. They may not include that as a form of violence that is certainly gendered, that is certainly within the household, and certainly within the family, that should also be included in this conversation. So even this kind of thinking around intimate partner violence can be expanded itself by using this understanding. So I'm just going to write that to make sure we have it here.
Danny, we also have a question about whether or not you want to share the PowerPoints afterwards. Now, I know we have the manual and that all of these slides, right? Do they come from the manual?
They basically come from the manual,
mostly?
Yes. Yeah, but for everyone on the call today, Zoom will share your emails with me, and I will send each of you a PDF version of these slides so that you can have them as well. And we'll link to the toolkits, which really has a deeper dive into all of these topics. But yeah, we'll send you everything that we can to make sure that you can use it however you'd like.
Great. There was another question.
Any other questions?
I mean, there's a lot.
There's a lot.
So you tell us when we have to move on.
We have about 10 more minutes to chat, so go for it.
Okay, good. One of the questions that came up was, what if there are no rules for women's rights in a country? And I think that's a great example of challenges for women's rights in, I would say, every country in the world, some greater, some less. So what can we do in advocacy around domestic violence in order to make rules in a country, in order to eliminate discrimination against women in a country? And one of the things we can do is look at documenting domestic violence in a country. Now, I know this is also in the toolkit for people who want to read more about documentation, but documentation doesn't have to be something that's big or complicated. It can be just very simple in terms of looking at numbers of who reports violence to clinics, or even looking at who might report it in peer-to-peer support groups, which I know our toolkit also talks about how to do those support groups. But the idea is just to capture a general number, and that number doesn't have to be big. It just has to be reflective of what's happening. And then you can use that number in your advocacy to say, 50 women every month, 100 women every month, 1,000 women over the year have been, reported feeling psychological violence or economic violence or physical violence. Sometimes that means we have to educate community members on what different forms of violence is, because a woman may not recognize economic violence as a form of domestic violence, which is part of why we do these trainings. But if we can capture those numbers generally, we can use them in our advocacy to push for domestic violence laws and to try and build pressure to get the kinds of laws and to challenge other laws that might be discriminatory against women, and as a result of that discrimination, lead to domestic violence.
Yeah.
So I just wanted to point that out.
Definitely, it's a great point, and we'll have some time later on in this webinar to dive a little bit more into that and more of a Q&A dedicated to that as well, if people want to ask more questions about that too. One question I see here is asking about online violence, and this is something that we have seen, come up in conversations with so many of our partners, especially now that we've moved to this remote world, many of us. Online violence is on the rise, whether that's in social media, whether that's emails received by organizations. It could be a number of different things. And this is, I think, a really interesting kind of thought experiment between domestic violence or gender-based violence. It can absolutely be a form of gender-based violence. It is, harassment. It is verbal violence. It can certainly be psychological in nature, really impacting a person in that way. I think, and Lisa, I'll ask you this. It's a little tough to apply this test to this example for online violence to see if it is domestic violence. I think it would probably be a rare circumstance where there's a family or household member committing online violence against someone within their household. So this might be something that falls more into that gender-based violence category. There may be more laws about this type of topic or laws that can apply to online violence. We see this really often with women's human rights defenders across the world facing online violence, different civil society organizations, LGBTIQ organizations. So it may be more of a gender-based violence, but not applied to domestic violence, if you agree, Lisa?
I would agree with that. I also see in the chat there's a question about whether marital rape, if it's not recognized as a crime under law, is it gender-based violence or domestic violence? What is it? I think that's a great question. It's both. It's both, depending on who you're looking at. So it's domestic violence because marital rape is domestic violence for sure by definition. And if it's not illegal if it's not made a crime under law, then that law is discriminatory. And the government makes the law, and that's what makes it gender-based violence. And the way we connect these two issues is by pointing out how, when you don't have marital rape recognized as a crime under law, it leads to domestic violence. It leads to impunity for marital rape. So we can make those correlations between law and domestic violence in our advocacy by pointing out that issue. So great question.
Yeah, definitely. We have a few minutes, and I just, my chat box just disappeared, so I'll try to get it up. But I saw a really great question that I wanted to think about a little bit in the Q&A box. So essentially the question is asking, how do we navigate and advocate to end domestic violence? Does it need to go beyond domestic violence? Does this conversation need to go beyond that if we're thinking about workplaces, schools, in addition to the household or family? And I think we'll talk about this a little bit later on, but something that we at MADRE have seen with our partners that is really innovative and I think really important is combining COVID-19 messaging and prevention messaging with domestic violence messages. And this is important for two reasons, and I won't go too into it because we will talk about it later. But first reason is, you have humanitarian organizations, you have civil society groups, grassroots groups who are already on the ground providing services and prevention information to people about the vaccine. If you add on domestic violence messaging, then that really saves you resources. It saves you people power, it saves you, flyer costs and printing costs if it's all in one place. The other important reason is that it really is a very smart way and a really convenient way to start to incorporate more of this gender conversation into COVID-19 messaging. It gets this domestic violence topic and this, maybe for some people thinking about this differently for the first time, it really gets this into their households. And I don't want to say a secret way, but in maybe a little bit more of a clever way or more of a clandestine way of making sure that people receive information they might not have received otherwise. If you live in a country where these conversations are private, they don't happen in government spaces or community spaces, this can be a way to really start that conversation within households by combining these two things, because everyone's getting COVID-19 messaging, or hopefully everyone is getting some sort of prevention information. And if you can start to really bring about gender equality and gender-based violence and domestic violence conversations, you start to kind of chip away at some of the stigma and some of the silence associated with it. We've also seen governments use the pandemic as an excuse to pass discriminatory laws that either limit the types of things that are considered domestic violence, or they're just passing legislation that really harms all types of different people and all types of different intersectionalities. And if you try to kind of stop that by really working on a grassroots local level to really chip away at that stigma and that discrimination, this is one effective way to do that, because you're already doing the messaging. Why not include domestic violence messaging into that as well? And we'll talk about that a little bit more. Any other, Lisa, do you see any other good questions we want to pop into? And again, we'll have more of an opportunity later as well. So we can.
Yeah, I would just say, just wrapping up, applying the test for domestic violence, again, is it done by a household or family member? So that would mean family members that live with you or do not live with you. And household members would include people who might live with you, but are not a family member. So, and we have different forms of domestic violence defined in our toolkit, which include, denying women reproductive rights, economic violence. So yes, that economic violence would include a woman who does not have control over her income. That is definitely an example of economic violence. I see that in the chat as well. It includes, marital rape, whether it's a crime under law or not. That's a form of domestic violence. It also includes violence against, women with disabilities or people with disabilities. So if somebody is disabled and, they're forced into regular control, if they're not allowed to leave the house or go outside because maybe they need help to do that and their family or household members are unwilling to help them, that's a form of violence. By refusing to help somebody with a disability in your home, that's a form of violence. Or someone who's elderly, or someone who's a child, those are all forms of domestic violence as well. They may or may not be gendered, depending on if gender was part of the equation for why the perpetrator did what he or she did. So if it was because she was a woman, or an LGBT person, then it would also be gender-based violence. So, these are all great examples of gender-based violence and domestic violence. And, and I see, yes, it would include access to abortion, especially in health circumstances, or just access to abortion generally. All of that is also either gender-based violence or domestic violence, or both, depending upon our test. Was that access to abortion denied because of a family member or a household member saying, no, you can't, I won't pay for it, or I won't take you, and you don't have another way to get to a doctor, or you have no other way to pay for a doctor? That could be both economic and reproductive violence, both forms of domestic violence. If the government doesn't allow it, how do we advocate to change that law? We say it's linked to domestic violence, that if you don't change this law, one, you're violating women's rights, but two, we're going to see an increase in domestic violence, because this is a way perpetrators can exert control over women. So these are it's a way to reframe how we think of domestic violence, because we know in the pandemic, domestic violence is on the rise, that it has been overwhelming in countries from Europe to South Africa to Colombia to Iraq to Syria, everywhere, to the United States, everywhere the pandemic is, domestic violence has risen. So these are ways that we can look at that rise in domestic violence and not only challenge lawmakers and policymakers to increase funds for programs and look at how we can change those programs, which I know we're going to get to, but also how we can tie domestic violence increases to changing discriminatory laws against women or lack of protection in law for women, to advocate for those changes. And so, these are things that we should be thinking about in terms of how we look at domestic violence. It's not isolated. It really does tie to everything we're doing. So if we want to change a mitigation for honor crimes under law, if we want to change the access to inheritance or right to sell your property, or rights to family rights, including the rights to custody of children, personal status laws, all of these issues that women's rights activists in countries every day are challenging. All of these issues can be bolstered in our advocacy if we tie it to the increase in domestic violence that's happening in the pandemic. Because there's some, we see this trend happening. So we are in a moment and everyone's paying attention to the pandemic, and we need to raise visibility about the rise in domestic violence to the pandemic. And then we need to use that to call for change for laws that discriminate against women by showing how they contribute to domestic violence in the pandemic. And so it's a moment that gives us a new tool to create new change for campaigns that have been, the activists have been fighting for such a long time.
Absolutely. I think that's a great point, that this is, we're talking about this in this very unique moment with the pandemic. And, the next hour we'll be focusing on different tools to use within the pandemic, but this is beyond that. This goes years into the future. This is a broader conversation about really getting at gender equality and developing this kind of thinking in communities, and making sure that we seize this moment to really have an impact. So that's a really great point, Lisa. So I see questions still coming in, but I'm going to keep us going to the next topic, and we'll have more time for questions at the end, so don't worry. But I want to turn us back to our toolkit and some of the different types of things that we saw happening across the world from these grassroots groups that we compiled into this one location for everyone to use to adapt as they see fit. So we're going to go over 3 different categories, essentially. The first is preventing, the second is addressing, and the third is documenting domestic violence. So we'll talk a little bit about each of those 3, but of course the toolkit is always there for more conversation. There are some really great sample quizzes, sample radio programs, some multiple choice questions, different types of things within the toolkit that you can use to hopefully spark some idea that you can use within your community. So first, we'll start with preventing domestic violence. One of the things that we saw that was most effective was for community leaders, for organizations to engage community leaders to promote zero tolerance for domestic violence. So this means that community leaders and other influential people in communities, whether that's really local or even national, can use their power and social standing to promote progressive gender norms. They can promote, encourage healthy relationship behaviors, and they can even come out and condemn domestic violence specifically. They can also use their platform to debunk harmful stereotypes about gender roles, including household responsibilities. They can help uproot patriarchal norms that are at the root of gender violence. And we saw many organizations doing this. They were having their community leaders, influential leaders, do a YouTube video or a Facebook Live video or send tweets that can overcome the barriers of the pandemic. It's all virtual, but they can still get the information out there that they need. This is related to the next point that we saw that was really effective, was producing or sponsoring online and shareable podcast programming. So this can be for youth, this can be for young couples that teaches positive and healthy relationship skills. In Colombia, there is a group of youth activists who are performing online skits to teach nonviolent ways to handle real-time frustrations, real-time family conflicts that might come up during the pandemic. So again, it's a group of activists who are doing something virtually, who are able to share this over the internet in a way that is really effective. It connects with youth and can also be applied to adults as well. We talked about this already, so I won't go too far into it, but integrating domestic violence prevention messaging into COVID-19 prevention messaging. So this could be, two examples we have are, there's a Palestinian organization that developed a women's rap group in a refugee camp, and they created a dance to go with that rap. So after the outbreak of the pandemic, they're starting to do songs about preventative care, mental health effects of the crisis, and domestic violence in video chats with people within the community. So it's something that it can be catchy, it can get into people's heads, and they can't get the song out of their head. But they're combining that prevention messaging with anti-domestic violence messaging. There's another really innovative thing that we saw that really applies to a lot of different things we'll talk about today, which is the use of Bluetooth sharing. So Bluetooth, for those who know, or a reminder for those who know, is essentially a way to share small audio files or video files from phone to phone, device to device. It does not require the internet. You really just need to be within 20, 30 feet of the person to share these files. So we have examples of organizations, specifically in Sierra Leone and Democratic Republic of Congo, who are creating podcasts or even shorter little audio clips that they're sharing across Bluetooth. And this really helps rural communities who may not have access to internet. This could absolutely be used in displacement camps where they also might not have as stable of an internet connection. And in terms of the pandemic, it's a really great way to share information without being close to someone. You can share it within 30 feet. And as long as they know to have that kind of Bluetooth function turned on their phone, it can kind of spread like wildfire. It can be this person-to-person connection and this person-to-person communication that shares this type of messaging. So these are just 3 examples of preventing domestic violence and how to do that within the pandemic. 3 really interesting kind of topics that we saw from across the world. Next, we'll talk about addressing domestic violence. So this is a little bit, it's opposed to prevention, where you're trying to stem domestic violence at the beginning. This is more trying to help those who are at risk or supporting survivors of violence. So one thing that we saw that was very effective and important was redirecting psychosocial support services through online mechanisms. Many groups across the world might have a more in-person model. They may have support groups in their office, or they may try to connect with people when they see them at the market. But if you are able to kind of transition a lot of that to online mechanisms, you can still be in touch with people at risk or survivors who need that psychosocial support. There's one example of a women's organization in Kenya that is holding weekly awareness campaigns via text message or via SMS on COVID-19 prevention. And they're also doing weekly mental health education and counseling via phone, via text messaging. And they're sharing the information about the number to call or the WhatsApp platform to connect to. They're sharing that information at food and sanitation distribution centers. So places where people are going to get COVID-19 prevention medical supplies, or where they have to go to get food after they have the proper medical protection. They're going to the places where people still have to be to then share the message that things are moving online and that they can still receive support in that way. Another thing was to provide support to those living in social isolation. So with this one, it's more about connecting with those who are stuck in a potentially violent situation. Abusers often have a close watch on the people at risk of domestic violence or those that they've already hurt in some way. So those at risk or survivors are often not able to come to a shelter or meet with a counselor, not only because of the pandemic, if those shelters are open, but also because their abuser may not let them leave the home or has a very close watch over them when they do leave. So with this way, you can still provide support remotely, or at least share some sort of information remotely to those living in isolation. So we have an example of an indigenous women's organization in Guatemala that is producing radio broadcasts, on domestic violence prevention in an indigenous language, helping to reach those women who do not speak Spanish. So this is something that was not being done before, partially because most of the domestic violence messaging could have been done in person, but now they don't have that resource. They don't have that in-person connection, so they have to switch to this more virtual way of radio broadcasts. There's an organization called Deaf Women Included that is producing and distributing social media videos in sign language, containing resources for gender-based violence and domestic violence survivors. Something that, again, they may not have really needed to do before this moment, but something that really still helps to address the issue in the midst of the pandemic. And the third thing that we saw time and again was organizing community responses during stay-at-home orders. So community members like family, friends, neighbors are oftentimes more easily accessible than an organization who may be in another town or another location. And these community members are often able to intervene faster than others. Survivors are often not in a position to reach out for formal support services, and they can really depend on those community members to stop violence or to reach out to emergency hotlines on the behalf of the survivor. This really helps to let the abuser know that there are people in the community who are there, who are aware of what is happening, and they can actively condemn domestic violence to help deter further abuse and to make sure the person knows that they are supported. So this can look like many different things. One example is an organization that has organized in a way that in moments of tensions where potentially you hear escalation of a conversation to shouting or violence, or in a home that you know where violence has occurred before, they have organized in a way to essentially bang pots and pans loudly around the home of the person being abused, so that the abuser knows that people are outside ready to support that person and that they should stop the violence. This has proven to be really effective in close-knit communities. Again, another effective way to avoid being in contact with one another. You can stand outside of a neighbor's home and bang these pots and pans without being at risk of COVID. Another example that we have is from a group in Lebanon that hung phone numbers for a domestic violence hotline on a bed sheet and then put it over a balcony, so that anyone who was walking through potentially could see that number and call the number if they needed it. So some really clever things are happening that communities are really mobilizing together to ensure that information is still getting out, still supporting survivors, still letting abusers know that there are people supporting these survivors, so hopefully deter that violence and stop it when it does happen. I want to pause here to address any questions on these two sections before we jump to documenting. If you have any questions, again, about preventing or addressing domestic violence, we're happy to take them. Let me open up the chat and see what we have. I'm seeing some people chat with each other, which seems really great. I'm really happy to see that. So go for it. We love to see this space used to share different ideas with each other. And a resource is here as well. So thank you so much for that. I'm just scrolling through. I'm seeing a few comments about, needing a basic change of society. And I think that's a really good point, that this conversation needs to extend to broader spaces. It needs to kind of be the catalyst for a lot of different change and a lot of different conversations. As Lisa was saying, that if we link things to domestic violence, we start to see that change possible. And I think that things like preventing and addressing some of these unique ways can really help people start to not only stem the violence, support those who are at risk of it or experiencing it, but also develop these larger conversations about gender equality. So that's some really great points. So I'm not seeing anything too new, so we can, I think, move on to documenting, but of course, feel free to send in your questions, and then we'll have time at the end to really dive into anything else you may want to talk about. So let me just move on. Okay, so documenting. Lisa talked about this a little bit earlier on, but essentially documentation at its most basic level are evidence and facts that prove that a problem is real. So we're trying to prove that domestic violence is real within this broader understanding of domestic violence. Documentation is really crucial in determining what services are needed in your community and how organizations can respond to that need. So it isn't only just for governments to know that something's happening. It can really help organizations know where they need to dedicate personnel, where they need to dedicate funding. And it can be really, really impactful in helping really support community members in what they're going through. This is also a powerful way to support the voice of these organizations and really support arguments for legal and social change, as we've been talking about. Similarly, it's a really crucial way for showing the need for policies and laws that prevent domestic violence and to provide support services for these survivors. Documentation can be really powerful to support the calls for domestic violence laws in your country, or even better implementation of those laws that already exist. Potentially they're already there. This can potentially show the need for more government funding for organizations to help domestic violence survivors and provide these services, even if the government isn't willing to do it themselves. Maybe there's evidence within this documentation to support organizations who are doing it already. So what does this documentation look like? I'll just put up these slides here. It doesn't have to be heavy research. It can be snapshot data that helps show trends and draw conclusions. This can be monitoring an increase or a decrease in the number of calls to a hotline. It can be tracking the number of messages on Facebook or Twitter or WhatsApp to a support service. It can be, I think as Lisa said earlier, health records from a clinic, whether that's in person, whether that's virtual telehealth, if that's an option in your community. It can really just be writing down every time someone mentions a circumstance of domestic violence. And it can be on an Excel sheet. It can be in many different forms, but just having something to show that yes, domestic violence is increasing. Here are the numbers to prove it. Here are the people who have called us in the past year or so since the pandemic has come to our community. And here's why we need to address it. Here's why we need to dedicate more funding to it. Things like that, just that snapshot that can really help people see the problem. So in this slide here, we have just some things that we saw that were happening in these grassroots organizations and things that they were doing really well. Many of them were creating systems, as I said, to track the quantity and nature of calls for help. This can be something as simple as really just developing a codification system. So we have examples from one group that registers the name, the address, different information about a person on one computer, and only one person in that organization has access to that computer so that all the information is safe. Then they create a code for that person, and that code is what is used in the rest of the organization so that someone's identifying information remains confidential. Things like that, it can be pretty simple, but it can be really effective in making sure that someone's information is safe and that you're really able to capture the information of what's happening in your community. It's really, really crucial to document all forms of domestic violence to better address the specific needs of marginalized persons and communities. This is something we really can't forget. We need to use this understanding of domestic violence, use the test we've been talking about of family or household, but we need to make sure that it includes women. It includes disabled persons. It includes LGBTIQ people in your community. Other marginalized groups in your community that may not get attention and may not have services directed to them. It is so crucial that all of these groups are impacted. The elderly, youth, really anyone who could be impacted, it's important to include all of it. Because if we really want to make this systemic change that we're talking about, if we want to have these broader conversations, it really needs to be inclusive of everyone affected. And it really needs to show all of the types of people who are suffering from domestic violence or even at risk. So we need to include all of these people in our documentation. In other examples that we have in Iraq, a women's organization is documenting domestic violence from intake in their shelters and from survivors who call or contact them via social media. And they're tracking anyone who calls, no matter who they are. There's an Afro-Colombian organization in Colombia that is documenting domestic violence in their own communities and territories, and they're recording it in an online database, something that has never happened before, but really shows that we need to capture all types of people, all types of marginalized people, so that we can really make these arguments for broader change. An important note here is to remember confidentiality in documentation. Information provided by survivors needs to be kept confidential. Survivors' identities need to be anonymous to ensure their safety. A lot of people can be at risk if their information is released. If you have just some basics here, if you have access to a computer and the internet, keep all information on a password protected computer, and do not keep paper copies of documentation if you're able, if you have that computer. And do not store any of that identifying information on mobile phones, as they can often be stolen, they can often be lost, and it's important not to have the information accessible. If you use paper documentation, ensure that all documents are in a safe place, that they're accessed only by authorized staff. This is where that coding system that I mentioned could come in handy, where you have the name of one person on one paper and then a code for that person on the other, so that all the information can be separate, so that everything can be confidential and really contained in one place. There are a lot of different resources out there for documentation. And a lot of different groups that we've talked to have been very interested in starting this or formalizing it. A lot of them were doing it and they didn't even know that tracking the number of calls could be a form of documentation. So here we have just an example. This is an older resource from the World Health Organization called Putting Women First. It has some really great resources on how to, it does, researching, but essentially documenting domestic violence in specifically against women. Excuse me, the World Health Organization has a lot of different guidelines that you can look at to kind of have documentation 101 and how to go about it in a way that is effective, but also make sure that survivors are treated respectfully and that their well-being is put before all else. One other thing to mention here that many of the groups that we have worked with have pointed out is very important is that the well-being of the survivor really comes first before any documentation. The documentation can wait if someone needs support in that moment. This takes practice, and this takes really developing techniques and policies with the organization to make sure that every person feels supported when their story is being collected. But the well-being of our survivors really needs to come first, no matter the type of documentation that we are conducting. So again, I will direct you to the toolkit for more examples of different groups doing this and different ways you can do it. But this is essentially the main points that we have to share on documentation. So for the remainder of this time we have together, we wanted to leave it open to questions because I know it's a lot of material. For a lot of people, it may be the first time you're thinking about domestic violence in this broader way beyond intimate partner violence. So I will take down the slides, and of course I'll share them with you later, but we will just leave this open to questions that Lisa and I can walk through with everyone. So feel free to send in any questions you have. I'll pop over to the chat again to see if anyone has anything important. One example I wanted to touch on that I thought of a little later after the Q&A was an example of domestic workers that I think can be really interesting in different communities. Certainly in the US and Europe and probably around the world as well. Domestic workers often, they may not be family members of the family that they're working for, but they often live in the home with that family. Especially in the pandemic, we have seen moments where domestic workers essentially stayed in their employers' homes just to keep everyone safe and to make sure that the virus was not spreading. This, if we look at it with our tests, if violence does occur, it is still household violence. It is something that can definitely be considered domestic violence. We can think of it as physical, certainly if there is a more physical violence happening, verbal. This is a really good example of economic violence. It can be someone who is essentially beholden to the situation because of their economic well-being. And if they are threatened or if they are, in any way subjected to violence that could force them to stay because they have no other means of income if they leave. Absolutely, that is a form of economic violence. There certainly could be laws about this as well. And that's when we start to think about gender-based violence. Potentially it's not in the household, but if you apply the tests, you can see that domestic workers certainly fit this kind of broader thinking of domestic violence within the household. And this is something that you can also try to prevent. You can message to people who potentially employ domestic workers. You can try to address this in communities. You can try to message directly to domestic workers to make them know that, or to help them know that things that they might experience are a form of domestic violence. And then of course, the third kind of topic is documentation. Never forget to document if a domestic worker comes to you and says that they've experienced some sort of domestic violence in their home. This is something we need to capture too. It all counts. It's all part of this conversation. And I think, you know, domestic violence really, domestic workers, sorry, really helps to kind of demonstrate all three of these types of things that you can do within a pandemic to make sure that everyone is supported and has the services that they need. Just looking at the chat. See anything else? One person said that domestic violence exists but is blinded by the media because of customs and traditions. That absolutely is true in so many different settings. And I think we touched on this earlier, but it is so often framed as custom and tradition. But if we work to reframe it as violence, that's when this conversation can really happen. It definitely will take time in many places, especially with the media. And that's potentially where online violence comes into play as well. But that's certainly true in so many of the places where our grassroots partners have been working, that they're facing you know, community leaders or just a general sense in their community that what happens is custom or tradition. But if they work to reframe it, they can really broaden the conversation.
Yeah, I would just add to that too, that the pandemic is another way we can reframe it. That because the pandemic has so much attention right now, and we can show the link between an increase in domestic violence with the pandemic, that this, you know, showing that the problem of domestic violence isn't, you know, culturally rationalized or explained by showing its relationship to the pandemic. So to be able to say, look, the pandemic is on the rise, and then we see domestic violence on the rise. So this isn't linked to tradition. This is linked to patriarchy. This is linked to frustrations. This is linked to wrongdoing, because it's coming in as the pandemic is coming in. And being able to make that link, sometimes, not always, provides us with an advocacy tool, a way of reframing the domestic violence conversation, a way of opening the conversation about domestic violence again. Sometimes in advocacy, because domestic violence can be dismissed through you know, cultural acceptance, and that of course happens in every country from the United States to South Africa. You know, if we have that chance of being able to bring it up again, which is hard because sometimes it feels like old news, or it feels like something that shouldn't be discussed. So we need a way to be able to bring up that this violence is a problem. And the way we can do that is by showing that domestic violence is an epidemic within the pandemic, and that these two things are linked, and that you can't address the pandemic and all of its fallout without also addressing domestic violence.
Right, that's a really great point. Another question we have, or a comment really, is about children, which I think we haven't really touched too much on here. So I'm really happy to see this question. There's an example of a man who stays home and sends his children to sell flowers, tissues, etc., in order to get money for himself, for his own pleasure. And when the children get back home at night with little money, he beats them, and in many cases would kick them out to sleep in the street. If we look at the test, so let's go through the test again. Is this some form of family or household violence? Yes, it is. It's a father who is subjecting his children to physical violence, absolutely. Then potentially kicking them out on the street, another form of physical violence. If they're, you know, if it's cold, if it's dirty, he, you know, there's psychological violence there as well. That could be really traumatizing to children. Economic violence, because they're forced to work and then they receive none of those benefits. You know, I think sometimes, many times in many communities, children have to help provide for their families, but this is when that situation crosses that threshold into domestic violence. There's clearly something happening here in the household or the family that would make this a violent situation. It may not be gendered necessarily because we don't really know, you know, the example doesn't have the gender of the children, but this is regardless of that, this is still a really good example of domestic violence going beyond just spousal violence. Yeah. Any other questions? Send them in. Just scrolling through again.
Well, while we're waiting for questions, I could make a comment just on documentation.
Yeah,
There
go
was a
for it.
great comment about the need to be able to collect cases of domestic violence, you know, to both demonstrate the problem, but also to find solutions for these cases. And, you know, again, this is something we touch on in our toolkit that we'll make available to you after the workshop today. But also to say that, you know, outreach and documentation doesn't have to be intensive. It doesn't have to account for every case in a city or a country. And it doesn't have to be so thorough that it's exhaustive. And the other thing to keep in mind with documentation is you also don't need to document all of the details of violence unless you know you can use those details to move a criminal case forward, or you need those details in order to, you know, address a psychological or physical or economical or other need that a victim might have. And that's always something we want to keep in mind, because we want to make sure we're not re-traumatizing victims by taking their story over and over again. And that if we take it, that we can use the information that we gathered appropriately. So we're always thinking about, you know, only gathering the kind of information we need. So if you're a health provider or a direct service provider, there's some information you need to be able to help that victim move forward and get access to services. And if you're just documenting, then usually you need less information. We don't need all of the details. We just need enough information so that we can identify the issue as domestic violence by applying the test that Danny has talked about, and, you know, making sure it's not duplicative of other cases that we're documenting. And then we can use that information to build pressure in our advocacy. And that documentation, again, doesn't have to be exhaustive. That documentation can be what we call snapshot documentation, which really means sampling documentation. So if you can say, I visited 3 health clinics, or I talked to 2 peer-to-peer counseling sessions, and they reported that they're seeing an increase in domestic violence victims coming to them for services, whether it's hotline calls or a provider's office. If they're showing an increase, you can use that information to make predictions about what's probably happening in the rest of the country. So, you know, even documentation of just one provider in one neighborhood in one city saying, I'm seeing an increase, can give you that kind of information you need to say, look, if it's increasing here, then it's increasing everywhere. And if you're asking questions around the pandemic, or if you're saying, well, you know, what do you think triggered the domestic violence? And a victim tells you, you know, my husband lost his job, and you find out that that's related to the pandemic, you know, then you can say the pandemic, it's not just about, you know, the direct health consequences. It's also about the rise in domestic violence, because that husband lost his job, that increased frustration in the house, that led to domestic violence. Now we know the real reason domestic violence happens is because of discrimination. It's patriarchy. We know that. That is why domestic violence happens. And we know this because women who are the heads of their households, that maybe their husband is no longer with them, studies show that we don't see the same rates of domestic violence in women-led heads of households as we do with male heads of households. And part of that has to do with how discrimination works and how violence is used to enforce that discrimination. So we know that's really the root cause, but it can be helpful to show the connection between loss of jobs or loss of income or being locked at home, being socially isolated, not being able to leave your home. Sometimes it's increase in, you know, alcohol or other substances. And all of these things we can tie to the pandemic and say, well, the pandemic has led to these things happening, and these things have led to an increase in domestic violence. We can start to build an argument around addressing domestic violence in the midst of the pandemic. And that's not the only way to address domestic violence, but it's just one way to reopen the conversation if you're working in a community or in a society that talking about domestic violence falls on deaf ears, because people are listening to what we need to be doing about the pandemic. So this might be a way to bring in that conversation, bring domestic violence into pandemic conversations. So, you know, that's why we keep talking about this. You know, and of course, the toolkit's also about, as Danny talked about, all these other ways that we can work to address domestic violence, really for providers who already work on this issue and have the resources and tools to do it, how they can adjust their work to be able to help reach victims, you know, and stay safe themselves, and help victims stay safe.
We have a few questions from earlier on, and one from a few comments as well about different authorities and the systems that authorities put in place. One person specifically mentioned Haiti. There's another comment about Lebanon. And I think without really knowing the systems specific to you, I think oftentimes it is important to include local authorities, whether that's police or social workers or whoever it may be, in this conversation as well. And many of the tools that we have in the toolkit that many of these grassroots groups are doing can be used in that same way to get the same messaging to judges, police, prosecutors. You know, that can be within the pandemic or after it. It can be social media messaging. You know, judges and police and lawyers, they all have social media as well. They all have television ads. They all have radio programs that they listen to. They're going to be receiving the same information that you might be trying to get out to survivors. You can develop a system, and we've seen this with some groups, develop a system where they collaborate with local authorities to make sure that local authorities know what domestic violence is themselves, whether or not there's a domestic violence law. You can use this understanding we've talked about today, and you can use this test with local authorities, with local police, so that they know if someone comes to them, this is an instance of domestic violence. You can bring them your documentation. You can show them these things to really help them see that the systems they have in place, whether that's local or national or whatever it may be, really do need to change if they're going to be effective both in the pandemic and afterwards to prevent domestic violence. So that's a broader view without getting into specifics of who or what location you're in that the systems are. But it's definitely something you can do, and something that a lot of different grassroots groups are needing to do across the globe. Sometimes the police are the problem, of course. Sometimes the judges are the problem, or they're not implementing laws, and that's something to factor in. But all of these different messaging tools, or at least are a way to maybe start that conversation with them and change the dynamic.
Yeah, I would just add to that some examples that we have seen in other countries have included working with like the local police chief or local police and providing trainings to their members, and and giving them the resources and a training around how to identify a domestic violence victim and suggestions for how to intervene, because we know those interventions can look different than if it's a case of if it's a bar fight or a general assault. We want to treat domestic violence issues differently. But then also there are places where you just can't work with authorities, where that's not going to happen, and where the authorities themselves are the perpetrators. And in those cases, we have to look at our women's resources advocates and what they're providing to domestic violence victims. Are there ways to reach victims in a way that doesn't rise to police intervention? For example, sometimes what activists will do is they will put out podcasts or develop information through text messaging and develop coded language that lets advocates who do outreach to victims know if they're in trouble. So maybe it could even be a physical code. For example, if you need women to come intervene at your house because of domestic violence, this is a case where it would not be appropriate or useful to call the police, perhaps even dangerous. If a victim needs intervention at her house because things are starting to get heated, put a red cloth or red t-shirt outside your house, tie it to your doorknob, or move the flower pot from the left side to the right side of your house. And we will check. And if your neighbors or your community members are around and they see, maybe they can go knock on the door. They can interrupt the violence. And sometimes that's enough to calm it down. Or it could be a message on social media. It can be the way you talk about something on social media. Talk about, a dessert you want to bake and are looking for a certain recipe. That could be code for I need help. We're in the process of looking at, possibilities of developing an app that would be free and available in multiple languages, that would be disguised as something else so that women could have it on their phones for those who have smartphones, and be able to report locally to community service providers when they're in trouble, or when they see something or hear about someone who's in trouble. And we'll certainly keep everyone updated about that. But if you can't work with your local authorities, if they're the problem, then there are ways that you can try and figure out giving covert messaging without alerting abusers or police. And this also works for women's organizations to get messaging to potential domestic violence victims. So, the pandemic, again, provides some coverage for this. If you're passing out flyers for the pandemic, for example, brochures that talk about, stay 6 feet apart, make sure to wash your hands, you could include a little paragraph, and if you experience domestic violence, call this number. Or a little paragraph that's in the brochure at the bottom that kind of talks about this, or in your radio programming around the pandemic, or in podcasts around it, whatever it is that you might be doing in terms of outreach, or just developing new outreach around the pandemic, because that way a woman can have that brochure in her house and it doesn't look suspicious, but it has the information in there. And we've found that this has worked in other countries in terms of outreach ways to get information out there. And of course, if you are able to work with your police, you can do things not only like training, but you can also work with police stations to set up liaisons. So one thing we've also seen in other countries is a police station, activists, women's rights activists will work with a police station and say, if a domestic violence victim, if a rape victim comes into the police to report a crime, call us. Here's the number. Put it on your table and make sure you have it. If a victim comes in to report sexual violence or domestic violence, call this number and we will send one of our women's rights advocates to the police station to meet that victim. That way you're there with the victim if the police end up taking her statement, and you're there to be able to give that victim additional support and referrals to resources that she may need. So it can be a very simple way to also liaison with police in those situations where we can talk with police. And of course, in those situations where we can't, the examples I gave before, they are all in our toolkit if you need to refer back to them.
There's a question about what are the simplest solutions that can be proposed in society? And I don't know if I can answer those today. That's a bigger conversation, but it did remind me of one thing we haven't fully addressed yet that is in the toolkit. Is we wrote the toolkit with an organization that is a feminist organization that works with engaging men. They're literally called Men Engage. They're an amazing organization. And they work to provide information and solutions to men who may not have really had coping mechanisms kind of taught to them in the past, or helping them to see that hitting your wife or hitting your spouse or hitting your child is a form of domestic violence. It's not just something that happens in the home. There's a really great few pages in the toolkit about some messaging that you can have to, or geared towards men, about what to do if they're upset or frustrated. If you've lost your job and you are increasingly angry at home, what are some tactics you can do, whether that's for your own mental health or to support your family? What can you do to kind of minimize the risk of violence happening in your home? Obviously, men can be survivors and victims of domestic violence as well. So we don't want to say that only men commit domestic violence and that these tools are just for them, but it really can be helpful in many different settings. We've seen a lot of different groups gear most of their messaging to men. A lot of men have been home because of the pandemic, and many messages have been, support your wives, support your children in the daily chores that they were doing, so that now you can take on some of the burden and some of that work, so that things feel equal in the family, and that things stay calm, and that everyone is working together in a fruitful way, so that tensions really don't escalate. So there's some great messaging examples in there. And I think that's really something important that a lot of groups have found effective, is to not only try to reach the survivors, but to reach those who could potentially be committing the abuse, to kind of stem it before it even happens.
Yeah, and I would just, build off of what Danny said and just add in terms of solutions in society, that it, some basic advocacy requests you can make is increase funding to women's organizations who are working on addressing domestic violence. And this is also a great recommendation to make to the international community when you tie it to the pandemic. If you can tie it to the pandemic, you will get more likely more attention from the international community, who is putting resources into addressing the pandemic, than if we try to raise domestic violence on its own, for all the reasons we talked about. So one is just increased support. Also increase support for women's organizations who address domestic violence, so that they can adopt their programming in simple ways, simple but effective ways, to be able to reach more domestic violence victims within the pandemic. And those examples are all in our toolkit for you to see. And then last, I would say, is thinking about ways that we can also look to document. And again, it can be simple in terms of just looking at sample data. Call up a couple of clinics and ask them if they've seen an increase in domestic violence, and see if they've seen an increase from before the pandemic was at its worst to when we've been in the pandemic for a while. That comparative data tells us also that there was a sharp increase, that there was an immediate increase, the current increase. Because one thing that lawmakers who are opposed to addressing domestic violence will say is, it's an issue as old as time. It's an issue as old as history. Why are you bringing this to us now? So if you can show that it's not an issue as old as history, that yes, while it's been an issue forever, it's also now an epidemic because it has just increased so much because of the pandemic, which is true, then you have a reason to cause urgency that can be used. So those are three things that I would just look at doing, is look at how can we make some simple adjustments to our programming? You can refer to our toolkit for that. How can we adjust our advocacy so that we're pointing to an increase in domestic violence in the work that we're doing, and using that to call attention, tying it to the pandemic when we're pushing the international community or other bodies that are dealing with redress and solutions for the pandemic. And then simple ways to gather documentation that's not intense or thorough, because it really doesn't need to be, but still follows good ethical guidelines, which you can find in our toolkit, in terms of making sure we protect victims and witnesses and we're sensitive to their needs, and using that documentation. So those are really the three things that can help an advocacy campaign and a direct services work move on this issue.
Yeah, that's a great point. We have only a few minutes left, so if you have any burning questions, send them in and we will take a look. Just scanning again to see if there's any bigger items that we haven't really covered yet, but I think most of them we have.
I think we have. I think, Danny, you mentioned Men Engage as a good resource organization for how to engage men. I also see a comment about how a phone app in extreme cases could be a threat to women, which is totally true, which is why we're working to see if we can help efforts to create a phone app that's disguised as something else, so that it's not recognizable by perpetrators. I know we're almost out of time, so
just to add to the phone app, I think that's where those really creative and clever things like a radio program or a song that is about COVID prevention, but also includes domestic violence, kind of sneaks it in, that really can be effective. That song can be on the radio. That song can be something you look at on your phone that maybe isn't connected to domestic violence explicitly, that an abuser might not know to look for or might not realize is about domestic violence resources. it's tricky for sure, but it's those kind of clever things that just try a different method, try a different way of getting information out that isn't just a flyer or something like that. I see another resource someone shared about service provision during COVID that it goes beyond hotlines and mobile phones. So that's great. Thank you for that. Let's see, yeah. Okay, I think this is probably a good time to wrap things up for everyone. First, thank you all so much for joining us today. Again, I see people from all over the world, and we're really, really thrilled that you're here. And we hope that this was useful and interesting to you. I will follow up with all of you in the next few days with the toolkit links as well as these slides from this presentation so that you can use them in your own contexts. We would love to stay in touch. You can respond to the email that I'll send you. Our advocacy team email is advocacy@madre.org. I'll put that in the chat in a minute. You're welcome to email us. Let us know what your organizations are doing. We want to know what's working, what's not working, what are new ideas that you have either as a result of this webinar or that your organization is already doing. This is definitely a long-term conversation even after the pandemic ends. So we would love to stay in touch with you and we hope that your organizations or personal efforts are strengthened by this and hopefully that this has been a really interesting resource for you. So I want to thank our translators. They've been fantastic. Ahmed for helping us with the comments, everyone participating. It's been really great to see. Thank you to Lisa, of course, for being here with me to have this conversation. Please stay in touch. We will be in touch. And thank you all so much for being here today.
Well, thanks everyone. Thanks, Danny. This has been great. We're going to have another session like this again in June, so we'll keep you updated about that.
Yeah,
as well.
Actually, we'll have two. We have our next session will be in French and Spanish, I believe in April. We're finalizing the date for that, and then the next after that will be in Arabic and Kurdish again, so you can share with your contacts as well.
Wonderful. If you know anyone who couldn't make it, stay tuned and we'll let you know about the next one. And Danny will follow up with you about all of those resources, the slideshow and the toolkits for you. And thanks and stay in touch.
Yes, please.
All right. Well, thanks everyone. Bye.
Thanks everyone.